Everybody knows that Medicare has some pretty steep penalties, but nobody's really sure what the penalties are and how they come up with it, how they calculate it. So let's start with the biggest and the most popular, unfortunately, that hits the most people, and that is a late penalty on Medicare Part B. So many people are scared of getting this penalty that millions of people sign up for Part B when they don't need to, because they're going to continue to work and they're on their employer's health plan. They don't need to, but they're so afraid of getting the penalty, they're not really sure what to do, so they pay for Part B when they shouldn't. And that's something at the Medicare Family, we hate to see you waste your money. So many times we're going to say, don't worry about the penalty, you're fine. And then other people say, no, that's not true. This is how the Part B penalty works. If you are eligible for Medicare, so for most people that's at 65, and you don't have any other credible coverage, meaning you don't have health insurance at work, with a company that has over 20 employees. So you either are self-employed, you want to keep working, or you work for a small company, 5, 10, all the way up to 19 employees. You have to sign up for Medicare Part B. Now, if you don't want to sign up, nobody makes you sign up. Okay, you don't have to do it. But later down the road, whenever you would want to sign up for Medicare Part B, you're going to get a penalty because you didn't sign up when you were first eligible at 65. The penalty is 10% a year for every year you were supposed to take it that you didn't take it. So again, nobody's going to force you to take it. So a lot of people, they're healthy, they don't understand. And then 3, 4, 5 years later, they realize, oops, I didn't do it. And they call us at the Medicare Family and say, can you help us? Yes, I can. But I can't get rid of that penalty. It's 10% a year for every year that you were eligible, that you didn't have credible coverage, and you didn't sign up. And it's 10% of whatever Medicare Part B costs that year. So in 2022, Medicare Part B cost the average person $170. So 10% of that you pay extra every month is $17. Medicare Part B goes up every year. So next year it might be $200. You'd pay 10% of that. You'd pay $20 a month. The next year it goes up to, you see what I'm saying? The penalty keeps adjusting every year and getting higher every year, and you can never get rid of it. It's a lifetime penalty. The only people that get a penalty that can get rid of it are people on Social Security disability. So if you get Medicare before age 65, say you got it in your 30s, 40s, 50s, and you were eligible for Medicare then, a lot of people don't realize that they need to sign up for Medicare Part B after 24 months and Part D. So they make that mistake and they trigger a penalty. The good news for people on Social Security disability is when you do turn 65, the penalty goes away. They give you a clean slate, and now you can start over. Not just with your insurance choices, but your penalties are gone. So that is a Medicare Part B penalty. That is the toughest penalty. That's the 10%. But there's also a Part D, as in dog, or as in drugs, your drug penalty. Once you're eligible for Medicare Part D, your drug plan, if you don't sign up for it because you're the typical person that says, I don't take any drugs, or I take 1 or 2 cheap drugs that I get at Walmart, they don't cost me any money. I'm not going to pay $20 a month for a drug plan when I don't even pay $20 for my drugs. So you don't take Part B. And now 3 or 4 or 5 years later, you need Eliquis and it costs $500 a month, and you call the Medicare Family and you're like, I need some help. Okay, we can help you get Medicare Part D, but you're going to get that penalty. Again, it's a lifetime penalty. You will pay it every month for the rest of your life. And it is factored based on, it's 1% for every month that you were eligible for Part D that you didn't get it. So we take how many months that is, and then we times it by the average national price of Part D that year. And for the last 15 years, that's been right around $32, $33. So that's how you calculate your penalty. You will pay that every month to whatever insurance company you buy your drug coverage from. Now, the insurance company doesn't keep that penalty, so don't get mad at the insurance company for this. They are forced by law to collect it from you, and then they have to send it to Medicare. So those are the 2 most common penalties that we at the Medicare Family try to help you avoid. The last penalty I call the rich penalty. Nobody else calls it the rich penalty. I'm hoping this catches on, but it's known as IRMA. And that's what the rich people have to pay. And it is based on your income, your modified adjusted gross income, your taxes that you filed 2 years ago. So if you made more than the average American, you won't pay what the average American pays for Medicare Part B. You're going to pay more. So in 2022, the average American pays about $170 a month, but you could be paying $238, $336, $425, or $556, depending on how much money you made 2 years ago. So there's very little we can do to help you with that penalty, but there are a couple special exceptions that we can help you if you got married, widowed, divorced, annulled, if you sold income producing property. There's certain things that if you did that we can help you file an appeal with Social Security to get out of that penalty. But it's kind of a narrow window, but that's one of the services that we provide for you here. So those are your big penalties. And if you're getting a penalty already, you'll find out because it's on your Social Security statement. So you can go check and see if you're already being dinged every month. And we want to help you avoid those if you're not yet on Medicare. So be sure and call us. Let us educate you before you make that mistake. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.